Turning now to the latest with the hantavirus. An American has now tested positive. That patient was one of the 17 Americans evacuated from the MV Hondius cruise ship. They're now back in the U.S., and a second American is now also showing symptoms. NewsNation national correspondent Xavier Walton joins us live from Dallas. So, Xavier, health officials say the general public should still not be alarmed by this?
Markie, good morning. Yeah, that's exactly right. The risk remains low, at least according to the CDC, but still, that facility, when you're talking about those 17 Americans that were just transferred or shipped rather to Nebraska, to that facility itself that is going to be housing those 17 Americans is one of the most advanced, if you will, infectious disease facilities in the entire country. But we did get some new information about a couple of those passengers. As you just mentioned, one of them, one tested mildly PCR positive for the Andes strain of hantavirus, which is what was spreading on the ship. Now, another passenger also developed mild symptoms. Those two were transported to Nebraska inside of what the aircraft calls its biocontainment unit. The patient who tested positive will go directly into Nebraska's biocontainment unit, while the others are sort of assessed and monitored at the national quarantine unit. But doctors describe this quarantine unit like a controlled hotel stay. If you look at some of the pictures, it actually kind of looks sort of like maybe a college dorm room, but you get private rooms, food delivery, phone and video calls. There is some exercise equipment in there, plus daily symptom and vital sign checks. And while officials continue stressing the broader public, if risk remains low, some health experts say the long incubation window makes this situation worth watching very carefully.
If I was on the boat and now being shipped back to Nebraska, I would choose to stay there probably for 42 days.
So 42 days, that incubation period, Markie, lasts anywhere from 6 to 8 weeks.
Yeah, we know other patients have stayed there before for COVID, for Ebola in the past as well, in that Nebraska facility. Also, Xavier, just last week, we reported several Americans had already returned back home from that ship, some there in Texas. What are we learning about them?
Markie, so there were 2 in Texas and several others as well across the country, 5 states in total, Texas, California, Arizona, Virginia. Those are among some of the states when you look at the big map, but contact tracing, that's why it's so vital. Passengers monitored in those 5 states. They're watching for symptoms like fever, flu-like symptoms. As of now, none just yet. So I guess you could say they're asymptomatic. WHO recommends monitoring up to 42 days. As you just heard, no confirmed U.S. community spread. Still, again, bears worth repeating. CDC says public risk remains very low. As you know, normally hantavirus spread by rodents, but this strain appears to be transmitted person to person. But there are questions this morning about monitoring, about whether some transmission could happen without obvious symptoms.
When we say human-to-human transmission, we're talking about people who develop symptoms. But because we're not testing populations with RNAs, we don't really know whether there are subclinical cases. So there could be more human-to-human transmission than we actually see.
So we need some time, but federal officials and doctors are expected to provide a press conference right around 9 a.m. Central Time in Omaha. But still, I think I've said it like 3 times now, Markie. The CDC and health officials say the risk remains low, but doesn't make us feel any better, especially when you hear some of the news. And it has eerie similarities to what happened about 5 years ago now.
Sure. Yeah, and that's a critical message to keep on reiterating, is that this remains a low-risk scenario.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.